Welcome to A Day Away, where we go behind the scenes to meet the people who are working every day to help bring tomorrow's hospital to life. My name is Maria Borges, Director of Communications and Annual Giving at the CGMH Foundation, and I'm your host. Today, we are joined by someone whose dedication to patient care is felt every day in our emergency department. We're excited to welcome Korinne Horkey, one of CGMH's emergency register practical nurses. Korinne is a familiar face in our community and at the hospital, and she brings a unique perspective to the ED team. We are going to talk about her experiences, her work, and what the future looks like through her eyes as we prepare for tomorrow's hospital. Welcome, Korinne.
Thank you.
Can you just start by telling us a little bit about yourself and your journey on becoming a nurse and, what led you to healthcare and to emergency in particular?
Yeah, for sure. So I moved here to Wasaga around grade 2. Initially, I wanted to be a kindergarten teacher. I did a co-op in high school and then quickly realized it's a lot of work. So I changed my mind.
So you decided to become a nurse instead?
Yeah. Actually, no, there was another career path I chose. Yeah. Wanted to be a border security officer. Watched border security a lot. Went to Humber in Toronto, lived there for 2 years, finished the program, realized you have to be intimidating and kind of mean, and you have to carry a gun. And those were just 3 things I just did not fit my personality. So I didn't really do anything with that diploma, but it was life experience. I moved back home, and then I ended up getting a nanny job, actually, with a really wonderful family. And I spent 5 days a week caring for their daughter. And I think that's kind of what led me into wanting to pursue nursing. My grandma, she would always tell me that I'd make a great nurse, and she would always kind of push me to go that route. So then the family ended up having to move, and I figured, well, it's my opportunity to apply to nursing school. So I went to Georgian in 2021, graduated in 2023, and I actually got a clinical extern job here at CGMH in 2022, and that gave me a lot of experience. I was able to see
it's a busy place.
What the job entails, and I ended up working down in the emergency department for almost a year while I was in school. Realized how much I really enjoyed it, and I finished my placement. There was a temporary part-time job available right as I finished school, so it was perfect timing. Applied to it, and I ended up getting the job, and here we are.
So I know that you've lived in Wasaga Beach for most of your life. What does working at CGMH mean to you as a longtime member of this community?
So working at CGMH to me is really special. I think there's a level of community involvement. We live in a small town. It's a small hospital. There's a good chance the patients you see are either someone you know or someone that they know that you know. Yeah. So I think it adds that level of connection, and it can be very special. You can advocate for the community, and it's not just another patient. It's more special. Yeah,
people, like on our end of the foundation, when we get donations because people feel that I'm not a number. Like I feel like I'm part of, like they actually care for me because they know me, even though they might not know me. But I think that's definitely resonates with your patients. So well done, and thank you.
Thank you.
You have a meaningful personal connection to CGMH. Can you share what happened to you when you were 10 years old and how that experience influenced the way you care for patients today?
Yeah, absolutely. So when I was 10, I was really sick at home with a fever, and I guess I ended up having a seizure. So my mom had to call 911. They rushed me to CGMH, and I don't remember a lot of the experience. Obviously, I was really, really young and really sick at the time, but everything moved really quickly. I actually had to be intubated, which I had a breathing tube because I was barely conscious at the time. They ended up diagnosing me with viral meningitis. Yeah, so I had to be transferred to sick kids. They wanted me to go by air, like Orange, but it was too foggy that night, I guess. So then they had to do it by land. Yeah, honestly, if I was older, I think it probably would have really influenced the trajectory of my life in more of a negative way. But I think because of how young I was, I don't remember a lot of the scary
It was traumatic for your family, probably.
Yeah,
but not
my
as much
mom,
for you.
I could only imagine how terrifying that would have been for her. But I think it's helped shape the nurse that I am today. I think it's not something a lot of people go through, obviously. And it's special to me that I can understand patients and have a little bit more insight into what they're going through and the emotions behind it, and how
for sure, and the families too,
hard.
for sure. I'm sure, yeah.
Yeah.
Okay, well, that's a lot.
Yeah.
Is there anything specific you remember about the care you received? You were little, so it might not be relevant, but if you do have any special memory.
My mom, I reached out to her, so if that's okay, I can read what she told me.
Yes.
So she said that once the ambulance arrived at the hospital, everything moved very fast. I was brought down for a CT scan almost immediately, and the team was already communicating with specialists at sick kids to help determine what was going on. I do know the two doctors that took care of me. It was Dr. Houston and Dr. Cornell. Dr. Cornell still works at the hospital, actually. And
do you work alongside him?
Not often. When I took a temporary position in ambulatory care, I actually did see him.
Oh yeah, because he's a family doctor too.
Yeah,
right?
he would come on Fridays, usually in the morning, and see patients. So I actually mentioned it to him.
That's amazing.
Yeah, and he was really happy to hear the story.
Course,
and
yeah.
I had a copy of the report from sick kids, so I printed another one and I gave it to him.
Moment.
Yeah,
that's
and he's
amazing.
like, from his perspective, he said he doesn't always know the outcome of patients who end up transferred out. So it was special for him to get to know my positive outcome.
Amazing, yeah. Yeah, because I bet once they leave, right, like sometimes you just don't know what happens.
Yeah.
Yeah. Oh, wow, that's crazy. How does it feel now as an adult to work in the very same emergency department that you once helped you?
It's very surreal. Like sometimes I forget how cool it actually is, because the halls I walk through are where I was as a patient, and I think it's just a full circle moment for me, being able to be on the other side of it now, caring for patients that are going through very vulnerable moments. And
scary too, right? Yeah.
Very scary. Yeah. So
amazing.
I can try and be that calming presence and help families get through some of the hardest moments.
For people who don't often see the behind the scenes, what makes CGMH Emergency Department special?
I think it's the teamwork. It's obviously such a small hospital, small community. We get to know the staff, our colleagues, on a more personal level than you probably would working at a really big hospital. So I think we build working relationships with everyone. There's a lot of trust in our judgment and our colleagues' judgment, and it makes it really special because we all help each other. You never feel like you're alone.
You have each other's backs, yeah.
Yeah.
That's great. My colleagues and I are obsessed with the TV show The Pit.
So am I.
If you're familiar with the show, and you are, how does the emergency department here compare to that?
So it's definitely very similar. I think the main difference is the size. But I think it's one of the most realistic medical shows I've ever seen on TV. And it's pretty incredible, the themes that they bring into the show. I think they touch on a lot of really difficult topics that are often the reality of most days. It can be challenging to see patients in their most vulnerable state, and it also touches on really important topics like moral distress, burnout, system pressures that are not just unique to our hospital. I think it's everywhere at this point. You try your best with what you have, but you can often feel stretched with the amount of volume and acuity that you see in a day. I think the show perfectly touches on the human aspect of being a healthcare worker, and it gives the public a better idea of how we feel, but also how difficult it can be on the patient side as well.
Yeah, I was actually listening to Noah Wiley, the actor, and he was telling, in a podcast how people are reaching out to him, not just healthcare workers, but families of healthcare workers, and saying like, oh my gosh, I had no idea my mom, who was a nurse in ER, was going through this. Like, it gives them a perspective that we don't really know from the outside that's going on, right?
Oh, for sure. It's like, as a patient, you see a couple hours of the day, but we're there for 12 hours minimum. Yeah. Every day.
Yikes.
Yes.
Amazing. You guys are amazing. I don't know how you do it.
Oh, thank you. After a while, it gets easier. I think more with the hours, at least. The first few months of doing 12-hour shifts was awful.
I can only imagine.
Like, how do people function like this? But I think you just kind of adapt to it, and 12 hours goes by really quick when you're busy.
And you're always busy.
Yeah. Yeah.
So as a nurse, your job is very stressful, and you see many things in a day that most of us don't even want to imagine. How do you deal with the stress, and what do you do for fun?
So the reality of the job, it can be emotionally demanding. It can be very difficult to come home some days after some of the things you see. I think it's really important to have a good work-life balance and have hobbies that you enjoy doing outside of work, just to kind of detach and find that peace within.
Kind of reset.
Yeah, for sure. One thing that really helps is the coworkers that I have. I think it's a bond that we share very closely, and we're able to debrief and talk through some of the harder things. I think that really helps me. Outside of work, I really have started to enjoy Pilates. I've been going here in town at FS8. The instructors there are great. They're very engaging. I think it's just a really great form of exercise to release that stress that you hold on to, where it's not too exerting, but you do push yourself, and you do focus a lot on the muscle-mind connection. I also really enjoy thrift shopping. That's something I've been doing for a couple of years. I love DIY projects. I tend to go into different little hobbies with crafting, and I think it's a good way to be creative and turn someone's junk into a cool new piece that I will either put up on my wall or, and then in the winter, I tend to be a homebody. I don't love being cold, and I can be very accident prone. So skiing and snowboarding is pretty much off the table for me. I don't want to be another patient that comes in with a broken bone.
Preaching to the choir.
I tried snowboarding once last year. Didn't hurt myself, but I think that was enough for me. I don't see myself going into that. And then I have a really supportive boyfriend that I get to come home to every day. He's been great. We've been together just over 2 years. He helps me and lets me talk about how I'm feeling, and he's very, very validating with my emotions, which makes it a lot easier. And then, yeah, I've got two fur balls, my cats, Smeezy and Oliver. They're my favorite. Yeah, I think those are just having hobbies outside of work. I think it's a really important thing to have as a healthcare worker.
So as we prepare for the new hospital,
The staff at CGMH are always coming up with innovative ways to improve patient care. Can you tell us a little bit about what the ED Fast Track is and any other innovations that are happening in the emergency department?
Yeah, so I'm actually a part of the Fast Track program. It's probably been just over a year that we've had it now. It's been great. It's a way for patients to book an appointment for very minor conditions like cough, cold, sore throat, like minor fractures, sprains, things that often you would be waiting a really long time for in the emergency department. And it really helps patients who don't have family doctors, who don't really have a choice but to come to the emergency department. They actually come through our See and Treat department, which is where I work. We actually were given triage training.
Oh, okay.
Which was new to the RPN role, but because the conditions are often so minor, they're not complex, they're pretty straightforward, we're able to triage directly in our department, so then the patient just completely bypasses the main triage. And there's some days where the patient is triaged, seen and discharged within half an hour. I mean, obviously every day is a little different, but
I've done it with my kids, both my kids, and it's great. It's amazing.
And I think it's really helped with my professional development as well. I think it's helped me grow as a nurse. It's helped with my assessment skills, just being able to pick up on subtle changes in patients, what to look for. So I've appreciated that aspect of it as well.
In the early fall last year, CGMH opened the doors to the first MRI machine. How does that impact you, as an emergency nurse?
Yeah, it's been amazing since we've had it. I think as an emergency nurse, I mean, personally in See and Treat, I don't typically care for patients that directly go to MRI. But I've noticed really big changes behind the scenes just in terms of patient flow. Prior to having our MRI, we would have patients admitted on medical and surgical who would need an MRI, and we'd have to arrange transport to get them to usually Barrie at RVH. So they would have to wait sometimes days to have that transfer, and just coordinating a nurse to go with them, and then they have to come back, and then they wait for the results. It prolongs a patient's stay unnecessarily when they often could be at home recovering, but because it's not safe to discharge them without that test, they often have to stay longer, which then prevents people from being discharged, which then in turn in the emergency department, we have many patients that are waiting for one of those beds. So I think now that we have an MRI close to home, it's made a huge impact on how much faster patients can be discharged home, and then we have less
Make room for new patients.
A backlog in our emergency department, so we can see new people and give them the care they need.
Amazing, yeah. I mean, I know as we were raising money for the machine, we always talked about just not having to travel and like being here, but it's so much more than just that. That's amazing, yeah. Okay, so we are entering an exciting chapter with the new hospital in the horizon. What does the new hospital mean to you as both a nurse and someone who just lives in the community?
Yeah, I think I have a very strong emotional connection to CGMH. They quite literally saved my life. I wouldn't be here today without the doctors and nurses that were there for me in my most vulnerable moment. So I think having a new hospital that is equipped to care for the community we have, the growing population, having the space, the resources, I think it's very, very needed. And I think it'll make a huge difference in someone else's life as well.
From an emergency department perspective, what are you most excited about for the new hospital?
I think it's the space. I think at the end of the day, we just need more space. There's been a lot of shifts where we have the staff, we have the doctors, we just don't have space to see patients, and it makes it difficult. You're kind of trying to be creative to see patients in makeshift areas. I think this new hospital will be amazing to have the space to see patients and give them the care that they deserve.
Mm-hmm. And what do you hope patients and families will experience differently in this new space?
I hope they are given more privacy and more dignity. I think that's been a challenge with the space constraints that we've had. Often patients are separated by curtains, which it doesn't really give you much privacy. I know if I was a patient and I was telling the doctor my entire medical history and they were giving me information that is very emotional and private, I wouldn't want a stranger next to me overhearing that. I obviously understand it's an emergency department. It's out of your control in that aspect, but
yeah, but you shouldn't be thinking about that when you're in emergency, right? Like that there's someone behind the curtain over there that is listening to everything. Yeah.
In the last few months, even year, I would say, we've had to add beds and spaces in the hallway, which I couldn't imagine being a patient being treated in the hallway where everyone is able to look at you. I think it's just a very uncomfortable feeling.
It'll be great to have a bigger one for sure.
Another thing I really, really hope is different with our new hospital is the mental health space. I think our 2 mental health rooms that we have right now, just the location of them is very overstimulating. Yeah. It's in the busiest hallway where the EMS stretchers are usually located. So you're hearing the beeping, and I don't know if you've walked through the doorway between C and Treat and the main side. It is probably the loudest door I have ever opened and closed in my entire life. And I couldn't even count how many times in a shift I have to go back and forth. And as a patient in one of those rooms, hearing that door slam.
You're already in the stress alone, right? Like, yeah, and then you have that on top.
Yeah, I just think having a quiet, calmer space for mental health would be a huge, huge difference.
How do you hope your story will inspire others, whether future patients, young people considering healthcare, or donors supporting this project?
Yeah, I think local hospitals are very important, and they matter a lot, especially in small communities. I think the donations that we receive go a long way, and they make a really big impact. It's resources that we wouldn't have otherwise. So I think being able to advocate for that is very, very special to me. And I hope someone else in my position when I was a kid is able to continue living their life and following their dreams when they're in their most vulnerable position as well.
If you could speak to your 10-year-old self, the little girl who arrived at CGMH that day, what would you tell her now?
I would tell her how strong she was. And I would also probably tell her to apologize to her mom for giving her the biggest scare of her life. But I would just tell her how brave she was in that moment. And even though it was a really difficult experience then, I think it really shaped who I am today. And it's made me a stronger person. It's made me see life in a different perspective, appreciate my health. And I think it made me a better person because of it. And then I would tell her that one day I would be returning to the same hospital as a nurse, helping other people. Never in a million years did I think that would be my reality. Like, nursing wasn't exactly what I envisioned for my career when I was younger, but I think I just ended up exactly where I needed to be.
We're usually the ones to encourage people to be a part of the foundation photo shoots and podcasts and whatnot, but you actually reached out to us. which was a really incredible email to receive. We were we were all celebrating here. It was such a beautiful message. Why did you reach out? And, how do you think your story is going to support the work the foundation is doing here?
Yeah, so I was actually watching one of the Coffee and Conversations that was posted a week ago. And there was your part. You came on and you were like looking for new faces for the foundation and the campaign. And I've always wanted to share my story. I just didn't know who to talk to about it. And I just
glad
figured
you
it
found
was
us.
the perfect timing I didn't want to just email being like, hey, I'd like to be in the campaigns and the photo shoot. I figured I'd give a little backstory to my experience as well, kind of get to know me. So I'm not just showing up without actually getting to know me. And I think it's very full circle. I think my story started here, and now I can be a part of this new hospital and bringing my story further and kind of building that connection with the community to kind of understand where I came from, why I'm here, why I chose to be a nurse.
Mm-hmm. Yeah, and really, you're paying it forward in so many ways, because it's not just the care you deliver, but sharing your story helps us get people to understand what's happening behind the scenes, and it helps people to feel inspired to make donations and make the new hospital happen. So it's really amazing, and we're really grateful.
Mm-hmm. Thank you.
Hey, last question.
Happy to share.
Last question for you.
Yeah.
Can you share? So our campaign motto is "Tomorrow is built today."
Yeah.
Can you share a bit about what tomorrow means to you? Can you finish the sentence? Tomorrow is.
Yeah. So I did write down what I wanted to say for this. If it's okay, I'm going to read it because I often don't articulate my thoughts.
You've been amazing so far.
Way.
What are you talking about?
And this is something I really wanted to say fully. So for me, tomorrow is someone else getting the chance I once had. Almost 20 years ago, I came through the doors of this hospital as a really sick kid who needed people to save her life. I had no idea at the time how important those doctors and nurses would become in my story, and that's something I never take for granted. For me, tomorrow is gratitude. Because of the care I received here, I got to grow up, go to nursing school, and now I get to walk through those same doors every day as a nurse caring for this community. So when I think about tomorrow, I think about the patients who will come through our doors needing that same care. The hospital we're building now will be a part of their story too, and I think that's something really powerful.
Our sincere thanks to Korinne for sharing her inspiring story with us. And thank you for joining us in this conversation. We hope you enjoyed it. This podcast is produced in partnership with Saltwater Production Company. Special thanks to Joe Kelly for his support and expertise. For more information about the CGMH Foundation and Tomorrow's Hospital, visit tomorrowshospital.com. Thanks for listening. We'll see you again on A Day Away.